Hi, I'm Pat Williams, and this is another edition of Your Health Matters with Dr. Benjamin Bryant, who is General Surgeon and Chief of Staff at Conneaut Medical Center. And Dr. Bryant, are you prepared for Christmas?
About as well as I can, I guess.
You haven't, it tells me you haven't done any Christmas shopping yet.
A little.
Little bit?
Oh,
Okay,
yeah.
good. I haven't. I have not yet.
Oh, boy.
But, you know, I'm not in the Christmas spirit yet because it's not snowing.
Well, I walked outside the other day and it was 70.
Yeah. It's unbelievable this time of year.
Yeah.
We are supposed to get snow this coming weekend, so hopefully not too much. I see you have a guest with you today.
Well, yes, indeed. We're very, very pleased to have Dr. Pranav Periyalwar with us. Dr. Periyalwar is a gastroenterologist, which takes care of the gastrointestinal tract, including the liver and the pancreas and so on. And he's with University Hospitals. He practices here in Conneaut and also in Geneva, sees patients, does procedures here in Conneaut. So he's our guy.
You're new then.
I am. I just recently started in
Good
September.
for you. Congratulations.
Thank
and,
you.
Welcome to Conneaut.
Yeah,
Thank
it was terrific for University Hospitals to be able to get a gastroenterologist
Absolutely.
into our area.
Sure,
That has not been an easy thing to do.
sure.
So that's a big deal for the town to have access to Dr. Periyalwar's
Absolutely.
expertise.
Absolutely. Doctor, tell us a little bit about your background.
Well, I'm originally raised in Canada. I grew up there and did my training there, and then I came down to Case for my residency and fellowship along with my wife. I did internal medicine and then subsequently gastroenterology and hepatology. This has been a fantastic opportunity for me to come out to this community. I know there's been a good need, and I feel really welcomed here. It's been really just a wonderful experience. Everyone has done their very best to make me feel comfortable and at home. And I'm seeing people, who haven't seen a GI doctor and liver specialist in a long time. So it's been very rewarding overall.
Fills a huge need, that's for sure.
Absolutely.
Absolutely.
I just the other night had met with a friend of mine who goes to Dr. Kumar as a general
Yeah.
practitioner,
Mhm.
and said he was having some gastro problems, indigestion and stuff, and they tested him and they found that he might have some liver problems, and said that he had some spots on his liver and stuff, which they're looking into. Is that common? I mean, he's not a drinking person, really. He doesn't-
Yeah, absolutely. A lot of people can have something called fatty liver, which is a deposition of fat in the liver, and many people don't realize that fat accumulates, outside of the organs, but it also accumulates in certain organs like the liver. And when that happens, you have almost a development of scarring and damage of the liver over time, which can result in some other health problems.
What would cause a fatty liver? Is it diet?
It's a combination of things. It can be diet, exercise related, obesity. Some people who have high cholesterol and diabetes are also predisposed to that condition. But there's ways we tackle it and can manage it. And there's if you come in and see a doctor or you see myself, we have ways and strategies to help improve those type of conditions.
I have one of our co-hosts, I won't mention his name, but Doc knows him, said he had fatty liver, and one of the things that the doctor made him get off of was soda. He was drinking like 8-9 cans of pop a day.
Oh, really?
And the doctor
It's a
says
lot of
that's
sugar.
got to
is.
go.
Right.
That's a lot of extra sugar.
It's interesting because a lot of patients don't know that you can drink your calories, quote unquote, and people tell me frequently, I just eat, really tiny meals. And I said, what do you drink? I drink a 2-liter bottle of Coke a day. And I said, well, that's where I can't lose weight, doc. And I said, well, the reason is let's try to switch that Coke and make it into water. And I'm sure you'll see some benefit from that.
Sure.
And, it's something that most people don't realize, that there's calories and there's sugar in carbonated beverages like Coke and Pepsi and things like that are hidden.
That's right. You got to be a little bit careful with fruit juice too.
Absolutely.
Fruit juice, it's not pop, it's healthy, it's fruit, it's good
Right.
for you. Well, the thing is, it is in moderate amounts.
Right.
But boy, there's a lot of sugar in fruit.
There's a lot of
Right.
sugar in fruits.
I was reading an article saying that one glass of orange juice has 8 oranges in it. So,
Really?
you wouldn't go out, you wouldn't go out and eat 8 oranges, but you would drink a glass of orange juice. So, and a lot of the vitamins and minerals you're missing in the in the fruit juice is there in the orange itself. So, you
Right.
kind of have to think of it that way. It's a different way of thinking.
Yeah.
Unbelievable.
And if you don't, you don't know.
Right.
Mhm.
So it's
Exactly.
helpful if you do know. Fatty liver, it's no joke. I mean, it's emerging as one of the top reasons for liver transplantation, isn't it?
Absolutely. Yeah, there's more and more people on the transplant list from non-alcoholic steatohepatitis, which is the long form of saying scarring and damage from fat deposition. It can actually act in the same way as if you were an alcoholic. Your liver looks the same after years and years of alcohol abuse than it will from years and years of fat accumulation, and it has the same resulting effect on your health. Our transplant numbers continue to rise, and as you said, continue to rise from fatty liver. We're fortunate in Ohio to actually have an organ sharing network with Indiana and the adjacent states, which actually don't use their organs as frequently as they do in Ohio. A large part of that is people attribute it to higher speed limits and more frequent motor vehicle deaths in Indiana than in Ohio. But
There's really something to that, because you're going to transplant a liver. Where's that liver going to come from?
right,
Mhm.
You know?
exactly.
Mhm.
Yeah,
And that's, unfortunately, that's a frequent source of organs
right.
of a relatively healthy person who has a fatal car accident.
Yeah.
You mentioned hepatitis.
Hmm.
I've heard of it over the years, but I'm not real familiar with what causes it. Can you catch hepatitis?
Well, there's many different types of hepatitis.
Okay.
There's hepatitis C and B are very common in this country.
Okay.
Both of them are acquired through various means of bodily contamination. By that I mean, IV drug use, tattoos. There's a very low sexual intercourse
Mhm.
predominance of that, which is not as common as
Mhm.
in other modes of transmission. But the important thing to know about hepatitis is that it can't be caught through basic day-to-day contact. It requires you to have blood or body secretion contact with the
Okay.
person. So a lot of people have the misconception that if someone in your house has hepatitis, that means you're gonna catch it through the air or through sharing a glass with them. That's not at all true. But what is very important to know is that if you do have hepatitis, you shouldn't be fearful of that because it's something which is more and more treatable. We have newer medications which have very few side effects. So the horror stories you may have heard from some of your friends who nearly died from hepatitis C treatment are no longer the case. Our treatment and cure rates are, in the mid 95% or higher for patients. So
That's very heavy stuff, and that represents a massive evolution in the treatment of hepatitis. It used to be that, Dr. Periyalwar is talking about viral hepatitis transmitted by a virus, and those can be a little tough to treat, and some of the early therapies had horrendous side effects. But as he points out, that's evolving just like everything else in medicine, and now the treatment is very effective with much less side effects.
So it can be cured?
absolutely. We have lots of new drug regimes out there, and a lot of them have come to the forefront only in the past 2 to 3 years.
Really?
That's how fast it's moving.
Right. Even when I was in my early stages of my GI fellowship, I was treating patients with interferon, which is one of the medications that I was alluding to, which can cause really, really severe side effects, and even resulting in death. We no longer use that. And that's a big evolution in this field, I think.
I know there's a country singer, I think her name's Naomi Judd,
Mhm.
who she has liver problems caused by hepatitis.
Mhm.
Now, I don't know whether she still has it or if it caused damage to her liver
Mhm.
or not, but that's one of the reasons she retired from the
Really.
singing
Wow.
business, yeah.
Yeah, it can be a really debilitating condition, and
Mhm.
obviously, left untreated, it has a high mode of causing liver cancer. So that's why it's very important if you do ever have a history of it, or you suspect, in the 70s that you'd used drugs, IV drugs, or have lots of tattoos, or were incarcerated at any time. then you should just get a blood test. It's a very simple blood test to get it checked, and then you can get a referral to see a gastroenterologist or hepatologist, and to get on the path to treatment. And I think it's very important that people do that. I think it's one of the most important conditions. They're actually advocating that anyone born between the 1945 and 1965 always it's a routine screening test in the blood, hepatitis C. So.
Do you practice at this hospital here then?
Yes, I do. I'm here every Thursday.
Every Thursday?
Yeah.
Okay.
And I do my procedures in the morning. I'm a gastroenterologist, so I do colonoscopies and upper endoscopies primarily.
Okay.
And I do those Thursday mornings here in Conneaut, and I see patients in the afternoon in the clinic. I'm building up more and more people are coming in the community to see me, and thankfully Dr. Bryant has been gracious enough to refer many patients to me, and he has a great tie in this community, so
He does.
he's been wonderful, and all of the other staff have also been very accommodating and wonderful as I came
Excellent.
on board. I do, as I said, colonoscopies. So I do, anyone who requires screening colonoscopies at the age of 50, we recommend all men and women have colonoscopy at least once in their lifetime. And ideally, you should have it more than that every 10 years. But, that's kind of the part of the things I do here in Conneaut.
Now, you also, if I remember correctly, the gal said that you also work out of Geneva?
Yes, I do. I'm there Monday, Tuesdays, and Wednesdays in Geneva.
Okay.
Same setup I have there. I try to do my procedures in the mornings there. The reason I choose that is so that patients who drink the prep for colonoscopy have less time to fast and not eat, and it makes for your overall experience to be better. I find that by trying to focus on my procedures to get those all done by 11 or 12 o'clock in the morning, so that you have the chance to eat a regular lunch the next
Great,
day.
Yeah.
I was going to touch on the prep, which is a bit of a misconception too. A lot of people
Sure.
have, in the past, people, the most common thing, even when I was early in my training, I always gave patients a 4-liter big jug of Colite. Things have changed over the past years, and our American College of Gastroenterology actually has recommended prep guidelines, and we recommended a split prep for patients. We use Miralax. It's a very low quantity of liquid, so you don't have to be too concerned about drinking large quantities. It's really only 4 glasses at a time. And if you think you can handle that, then I think most people can at any age.
I know Dr. Bryant and I had a special show on this particular subject. And I think,
Right.
Doc, you said it has changed greatly from the old days,
Yeah,
and
it has.
it's a lot easier now.
It's like Dr. Periyalwar was saying, those old preps were brutal, and people
Right.
couldn't
Yeah.
tolerate them.
Yep.
They try to do it, they get
And it
sick,
scared
they
people.
throw up,
That-
and it would. It
Mhm.
would. And that factor is basically fine. It's not the greatest thing in the world. You don't want to
Right.
fast all day, and the prep, but, I have a lot of patients who say, boy, it's way easier than it
Absolutely.
used to be, so.
Most of my patients tell me that that's actually the hardest part of the whole procedure too. So if you can get
I've
through
heard that. I have heard
yeah,
that.
they tell me, they're like, "Well, this was nothing," and they wake up and they're like, "Did you finish the procedure?" I said, "Yes, it's all done."
Do you put the people out?
Yes, I generally use anesthesia assistants. So
That's the safe way to do it.
yeah, and I always have patients see the anesthesiology team and a nurse beforehand, the day before, just to get assessed and make sure that their overall health and medications are in order. So they come in once to talk with the
I might be wrong,
anesthesiologist.
Doc, but it seems like in the old days, they didn't put you out.
Right.
They actually,
I think that Dr. Bryan will speak more to that because of experience. But from my experience, you're right. We used moderate sedation, which was just twilight sleep, and I find that patients were really uncomfortable, kind of cramping and feeling a lot of pressure. Now I have really good results with my patients. Most of the time, when they wake up, they say, "When are you going to start the procedure?" And I
No
said,
kidding.
"Well, we're all done." And they're like, "I feel totally fine. I don't feel like you did anything to me." And I said, "Well, you shouldn't feel like that." So, we use certain medications which will completely put you to sleep, and we safely monitor you throughout the entire procedure. So that's kind of
That's
how
very
things-
important for people to understand that there's a dedicated, trained person
Right.
whose only job is to get the sedation right.
Right.
So they're watching closely and they're making sure that you don't wake up in the middle of the procedure,
Absolutely.
which is an unpleasant thing, and a lot of patients have that experience. But if you're using the CRNAs the way that we do, you don't have that problem.
Right.
Mm-hmm. Mm-hmm.
So patients don't need to be fearful about that.
Right.
There you go. That's good to know.
You have a patient who's had that experience where they woke up, and that's an extremely negative experience.
It is.
And that can deter people from getting the sort of care that they really need. And I'm not going to go back. I'm never going back. That was such a terrible experience. I'm never going to do it again. Well, it's not like that now.
Right.
If they, in the day, Doc, when they did wake up, or if they did wake up, can you get them back out again?
Well, yeah, you can, but you don't want to have that happen. Even there's a chance, there's a pretty good chance if that happens that they'll remember it.
Yeah.
So that when the procedure's all done, they have this terrible memory. I had a very bad time. Well,
Right.
that doesn't happen now.
Great. That's good to know.
That does not happen.
No.
Wow. Now, I hate to put you on the spot, but do
Yeah.
you know what your phone number is here?
Yes, it's 440-415-0118. That's my general scheduling line, and there's a local number in Conneaut as well. Off the top of my head.
That's all right. These are going to be displayed on the
Yes.
screen.
Okay.
The guys will make sure that they got that so that we can.
Right.
That helps,
see-
that helps.
see the
Yeah.
number.
Yeah.
Yeah. Now, do you see many patients here in town with pancreatic problems?
Oh, absolutely. I've seen quite a few with abnormal findings on their pancreas. I do, one thing that I guess it's a bit of people don't always know is that gastroenterologists also deal with the pancreas and pancreatic issues and that includes acute pancreatitis, which is inflammation of the pancreas, or chronic pancreatitis and inflammation. It can be caused by a variety of things like years of using alcohol or fat deposition in the pancreas, as I alluded to, fat deposition in the liver before can also happen. And there's certain autoimmune processes which are the body reacting against itself, which can cause inflammation of the pancreas. I treat patients with certain chronic pancreatitis and inflammation with medications and supplements which help to make their life better, basically tolerating certain foods and tolerating fat in their diet, and we use medications to help titrate that. I also do know a lot about the anatomy and of the pancreas and the biliary tract, and a lot of my colleagues and part of the Digestive Health Institute are advanced or interventional endoscopists. So if there is ever a reason for further investigation into the pancreas, which are more than just imaging studies, I have the ability to refer to some of my colleagues, which are in Geauga as well as in Ahuja, if we ever need to send patients out there for certain procedures, which are specialized.
Exactly, and again, see, this illustrates why our town is very fortunate to have a hospital that's affiliated with UH. It's because we have access to a depth of specialization that's just massive. So, if there's a problem that's a tricky one that's going to require more sophisticated technology, we have direct access to it.
Absolutely.
Just whoosh, right in, no problem. And so Dr. Periyalwar sees a patient, the patient has a pancreatic problem. It's more than you can just deal with through an MRI or that kind of thing. There needs to be a procedure, so he sends the patient to Ahuja. Are they doing ERCP at Geauga now?
There's some cases they're not doing routine ERCPs there.
Okay.
So primarily Ahuja.
Primarily
yeah.
Ahuja, which is fine because you don't have to drive in downtown Cleveland.
Right.
So then the patient goes down and sees the doctor in Ahuja, and the doctor gets on the computer, and there's Dr. Periyalwar's note.
Absolutely.
There's the entire record. There's all the testing that's been done, there's his impressions, there's what he's told the patient. So it's seamless. Whereas if you don't have that, then everybody's kind of fumbling around, well, who did you see and what did they say, and we can't find the
Right.
test results, and that's dangerous.
Yeah, I'm fortunate in that my team and the Digestive Health Institute and the rest of my gastroenterology colleagues are very personable, easy people to work with, and I actually will have talked to them about your case well before you see them. So they should know not only my note, they should know even further than that. They can reach me at any time by my personal cell phone if there are any specific questions. But rest assured, the issue of finding notes and not knowing who you are would not be something that you'd have to deal with in our UH system.
That's right.
And in the last 7.5, 8 years that Dr. Bryant and I have been doing these shows, we've actually seen the technology advance so much that there's no reason for double testing and different things that are going on, and you've explained that.
Oh, yeah. Well, yeah, it's a big deal. I mean, we do see patients here in Conneaut who've been in other health systems.
Mm-hmm.
And, sometimes we can get the records, not always.
Oh,
But, that's what I'm saying, it's hit and miss. Sometimes we can, sometimes we can't. We have to chase them down,
Right.
hunt them down, it takes
Yeah.
time and so on, which we do. But if people, this is a concept, you've heard me say this on these shows before, why this is important. Well, you guys, you're just trying to, UH is just trying to, and everybody's competing and there's a lot more to it than that. Okay, there's a lot more to it than that. This idea of having a single record for the patient that's throughout the entire system, that means two things, well, more than two, but two main things to you. And one is that things aren't going to be missed. Whereas if you're coming in from a different system, it might be, because we might not be able to get the records.
Right.
So things aren't going to get missed. That bears directly on patient safety. I mean, there's just no two ways about it. You miss something, that's a problem. So this is a way to make sure it doesn't get missed. And then as Pat alluded to, I can't tell you how many times I've seen it where a patient comes to me and they recently had a CT scan done in our system, and we go digging and we find out that, well, they'd had a CT scan, the same CT scan done 2 months previously in a different system, and nobody knew about it.
Wow.
So that patient just got a whole dose of radiation that they didn't
Right.
need. They got a test they didn't need.
wow.
Whereas if that had been within the UH system, we'd have seen it instantly, and that test would not have been reduplicated.
Right.
Mhm.
That also is a patient safety.
Absolutely.
Yeah.
So there's real reasons that translate into significant patient benefits to having one record in one place where all of your doctors can see the same record. That's a big deal.
And I don't know if many people know that Conneaut is the standard for patient safety and quality in our UH system. We have consistently performed better than many other of our hospitals, and we're really the benchmark, and they're trying to use this as a small microcosm to take to a larger scale in Cleveland. So you should feel really
Think
happy
about
about
that.
that.
Think about that.
Absolutely.
This little hospital out here that's part of the UH system
Absolutely.
is leading the entire UH system
Absolutely.
in these things.
That's
And it's been
great.
recognized by our CEO, by senior leadership, and time again.
Yeah.
That's wonderful. That's
Yeah.
great. You mentioned pancreatitis.
Absolutely.
I worked with a lady that was a little bit younger than I several years ago, and she said she had an attack of that. She goes, it was
Mhm.
one of the most painful things she ever experienced. Is that?
Yeah, it can be. I mean, I personally haven't had one myself, but
haven't either.
I can see my patients which are suffering through that. It's a really difficult thing. Sometimes, and a lot of the time, you really need to be hospitalized for it.
And she was, yes.
Yeah, and you need to rest your bowels for several days. You need to be on high doses of IV intravenous fluids, and pain medications. Generally IV pain medications to get through those several days. From the patients I've seen, it can be extremely painful, and what many people don't know is it actually also can lead to other complications in the short and medium and long term, such as cysts forming around the pancreas and inflammation causing destruction of parts of the pancreas. And that's why it's really important when you come in and you come into the hospital, you'll be set up to see myself as a follow-up in the clinic as a gastroenterologist and a pancreatologist, so I can assess, the health of your pancreas long term. So a lot of people brush things aside and they say, well, this was just a one-time thing, and I don't need to see a doctor after this. But by coming back routinely and getting your care here, you're avoiding future long-term complications. And I think that is our goal as physicians, more and more, to use preventative measures and preventative help to help benefit you in the long term.
If you ever have an attack of acute pancreatitis, believe me, you'll never want another one.
No.
So you'll want to make sure that you follow up and
Exactly.
and that you do everything you can to make sure that doesn't happen again.
Exactly.
There's a real incentive built in, believe me.
It is.
Wow, it's interesting stuff. This is a subject that Doc and I haven't really talked a whole lot about, so it's very educational
Absolutely.
to learn on this stuff. And I think people should, like you say, follow up on this stuff and not let it go and get it taken care of.
Yep.
Very good.
Yeah, if you have GI issues, which are incredibly common, okay, a lot of times your family doctor, your internist, your family practice doctor can help you with that. But sometimes it goes beyond that. Sometimes it's chronic and nagging, and it just seems to go on. And you don't have to live with that.
No.
Okay? You have access to somebody who can really sort of dig into that and all the nuances of it and tailor a treatment plan for you that's going to do something for you. And as we mentioned, right up front, a lot of times you don't know. Are you seeing a little problem, or are you seeing the tip of a big iceberg?
Right.
You don't know.
Exactly.
And you want to know that. So it's just safer, and it also leads to an improved quality of life to just not neglect this stuff. I mean, if you can prevent a serious GI complication down the line, believe me, you don't want to get into that kind of stuff
Right.
if you can avoid it, because those could be terrible problems that go on and on and on.
Right.
And if you can avoid that, it's great. So follow up, and if you're not getting where you need to go in terms of your quality of life and so on, you've got a resource available who can maybe get that into a better level. So don't neglect it, and don't feel like you're stuck with it. That's really the message, is don't feel like you're stuck with it and you got nowhere to go. You do got somewhere to go.
Mhm.
Absolutely.
Well, Dr. Periyalwar is going to be coming back. He's going, he's watching the community. He's seeing what's going on in the community. He's going to see the issues that are common, and he's going to come back to discuss topics in a little bit more depth that he sees going on here in town, and we'll be talking to you about things for you to look for and things that you can do to address these kinds of issues. And the first thing you got to do is you got to know about it. I mean, if something's going on, you don't know about it, you're defenseless.
Right.
So he's going to bring these things along and to your attention, and help you understand the things that you can do just in your daily life to avoid a lot of big problems. A lot of times we see people after they've been down that road a
Right.
while,
Yeah.
and the problems are now they're a lot tougher. Okay, the solution isn't as easy, it isn't as quick. It's something that really can kind of take over more and more of your life, and if we can prevent that, that's what it's about. So he'll be on talking about those topics, and we look forward to having you.
Thank you.
Back.
Thank you for having me.
By the way, Dr. Bryant, I did get an email asking you a question,
Uh-oh.
and I forgot to bring it with me.
Oh.
I apologize for that. I will email it to you.
Yeah, send it to me and we'll get it on the next show.
Okay,
No problem.
okay.
Yeah, please, people, in the past, the way that Pat and I have done this is that people have emailed Pat, and his email address hasn't changed.
Oh,
And,
Not yet, anyway.
You see this number here, the reason this number is here is so that you can call my office with questions about the shows, or other questions, or suggestions for other topics, or what have you. So that's one way to interact with us. Another is to email Pat, who will then send the questions on to you.
Absolutely, and we welcome that. We really do. Dr. Bryant always has an open door policy and welcomes any kind of questions out there.
Anything that people have questions about that's going to benefit people, absolutely.
Absolutely. All right, this has been great, and welcome to our town here.
Thank you. It's my pleasure to be
And I
here.
hope you do come back soon.
I will. Thank you.
Okay. And for everybody out there, have a very Merry Christmas and a Happy New Year. We'll see you in a couple weeks.